So I'm giving a general anesthetic. Do I need to intubate my patient, or can I get away with using a supraglottic airway like an igel? How do I decide? Now, as we've said before, there are only two reasons to put an ET tube down, and those are to protect the airway and to allow you to replace the patient's work of breathing. Now, a supraglottic airway sort of does this too. It'll hold the upper airway, the mouth and the oropharynx open, and it'll prevent the airway from obstructing. But it doesn't really protect it in the same way that an endotracheal tube does, because it doesn't form a complete definitive seal to stop aspiration if the patient vomits or if there's blood from the upper airway. So it doesn't offer the same level of protection. When it comes to ventilation and doing the work of breathing, actually most supraglottic airways, if they're sitting well, if they've got a good seal, do pretty well, especially if it's one of the newer generation ones that have a seal such as a Supreme or an Oragain. These ones are generally very good, but the short answer is you won't be able to provide the same amount of ventilatory pressure as an endotracheal tube. So that's how you make your decision. How well do I need to protect the airway, and how well do I need to provide mandatory ventilation? If you have emergency surgery for a patient who has not fasted and is at risk of aspiration, they need a tube. If it's elective surgery for a fasted patient and they are not at risk of aspirating, a supraglottic is perfect. Finally, if you're going to need to generate lots of pressure, such as a morbidly obese patient or someone in an extreme position, such as very head down or prone, then you're going to need an ET tube to reliably generate that kind of pressure.